Prioritization of people with diabetes would mean acknowledging diabetes as a life-threatening condition, considering subsidizing diabetes medication as it is with the AIDS levy, thus ensuring affordability and access, workshops to equip our healthcare professionals with up-to-date information on the management of diabetes, above all, empowering the diabetic patient to manage their own condition.
Being able to have access to healthcare professionals with knowledge in diabetes could significantly impact the outcomes in my country, taking into account people living with diabetes require multidisciplinary care to be able to have physical, emotional, mental, and nutritional health. People living with diabetes at some point or various in their lives may present distress, burnout, depression, amongst other conditions that could impact their daily management. Being able to have access to healthcare professionals with knowledge in their condition could help them not only have a better relationship with their condition, but also their bodies, their mental health, and their treatment, allowing them to feel safe within their own bodies.
Prioritization of people with diabetes would be like giving enough confidence to people that they can openly live their lives to the fullest. No stigma, no myths, no misconception or discrimination would follow them at any place, be it their workplace, family, or life after marriage.
Real action on diabetes and affordable insulin in my country would look like no young person being afraid to dream because their parent can't afford to buy them insulin. It would also look like that young lady from a remote part of the country not having to worry about waking up in a hospital bed in diabetes ketoacidosis because her parent can't afford to buy her the insulin that she needs while taking care of her other siblings.
100 years since the discovery of insulin, many governments till date lack policies on selection, procurement, supply, pricing, and reimbursement of insulin. Monopoly and markups in the supply chain affect the final price to the consumer, a consumer who can die without that life-saving drug. A real action on diabetes requires unique solutions so that every child can have a dream and live up to those dreams, so that no kid living with diabetes has to ration his insulin just because of financial constraint. Diabetes wasn't my choice, but my choice is to voice for real action, to hold our governments accountable, because healthcare is a human right.